Nursing Exam Study Practice. Welcome to our nursing education video on the GI, abdomen, heart and neck vessels, hypertension, and peripheral vascular and lymphatic system. In this video, we will be focusing on 10 multiple-choice questions that cover key concepts related to these systems. These questions are designed to test your knowledge and understanding of important nursing concepts related to patient care. We will provide you with the correct answer to each question, as well as an explanation of why that answer is correct and how to rule out the incorrect answers. Whether you are a nursing student, a practicing nurse, or simply interested in learning more about these systems, this video will provide you with valuable insights and knowledge to improve your patient care. So let's get started. 1. Which of the following is a common cause of peptic ulcer disease? A. Vitamin C deficiency. B. Bacterial infection. C. High-fiber diet. D. Excessive alcohol intake. Answer: B. Bacterial infection. Explanation: Peptic ulcer disease is often caused by a bacterial infection with Helicobacter pylori. Option A, vitamin C deficiency, is not a common cause of peptic ulcer disease. Option C, high-fiber diet, is not associated with an increased risk of peptic ulcer disease. Option D, excessive alcohol intake, can irritate the stomach lining, but it is not a common cause of peptic ulcer disease. 2. What is the most common symptom of gastroesophageal reflux disease, GERD? A. Chest pain. B. Difficulty swallowing. C. Heartburn. D. Vomiting. Answer: C. Heartburn. Explanation: The most common symptom of GERD is heartburn, which is a burning sensation in the chest. Option A, chest pain, can be a symptom of GERD, but it can also be a symptom of other conditions, such as angina. Option B, difficulty swallowing, can occur in severe cases of GERD, but it is not the most common symptom. Option D, vomiting, is not a typical symptom of GERD. 3. Which of the following is a common sign of acute appendicitis? A. Nausea and vomiting. B. Diarrhea. C. Right lower quadrant pain. D. Left lower quadrant pain. Answer: C. Right lower quadrant pain. Explanation: Acute appendicitis typically causes pain in the right lower quadrant of the abdomen. Option A, nausea and vomiting, may also occur, but they are not specific to appendicitis. Option B, diarrhea, is not typically associated with appendicitis. Option D, left lower quadrant pain, is not a symptom of appendicitis. 4. Which of the following is a risk factor for developing hypertension? A. High-fiber diet. B. Sedentary lifestyle. C. Low salt intake. D. Normal body weight. Answer: B. Sedentary lifestyle. Explanation: Sedentary lifestyle is a risk factor for developing hypertension, along with other factors such as a high salt intake, obesity, and a family history of hypertension. Option A, high-fiber diet, and Option C, low salt intake, are not associated with an increased risk of hypertension. Option D, normal body weight, is not a risk factor for hypertension. 5. Which of the following is a sign of peripheral arterial disease, PAD? A. Warm, red skin on the legs. B. Thickened, discolored toenails. C. Weak or absent pulse in the legs. D. Swelling in the ankles and feet. Answer: C. Weak or absent pulse in the legs. Explanation: Peripheral arterial disease, PAD, is characterized by reduced blood flow to the legs due to narrowed or blocked arteries. A weak or absent pulse in the legs is a common sign of PAD. Option A, warm, red skin on the legs, is not a typical sign of PAD. Option B, thickened, discolored toenails, is a sign of fungal infection, but it is not associated with PAD. Option D, swelling in the ankles and feet, is a sign of peripheral edema, which can occur in many conditions, but it is not specific to PAD. 6. What is the most common cause of acute gastroenteritis? A. Bacterial infection. B. Viral infection. C. parasitic infection. D. Fungal infection. Answer B. Viral infection. Explanation: acute gastroenteritis is most commonly caused by a viral infection, usually from the norovirus or rotavirus. Option A. Bacterial infection can also cause acute gastroenteritis, but it is less common than viral infection. Option C. Parasitic infection can cause gastroenteritis, but it is also less common than viral infection. Option D. Fungal infection is not a common cause of acute gastroenteritis. 7. Which of the following is a common symptom of inflammatory bowel disease, IBD? A. Diarrhea. B. Constipation. C. Abdominal pain on the left side. D. Heartburn. Answer A. Diarrhea. Explanation: inflammatory bowel disease, IBD, is a chronic condition that causes inflammation in the digestive tract, leading to symptoms such as diarrhea, abdominal pain, and weight loss. Option B. Constipation is not a typical symptom of IBD. Option C. Abdominal pain on the left side is more commonly associated with diverticulitis or colitis than with IBD. Option D. Heartburn is not typically associated with IBD. 8. Which of the following is a common cause of lymphedema? A. Bacterial infection. B. Viral infection. C. Parasitic infection. D. Blockage of lymphatic vessels. Answer D. Blockage of lymphatic vessels. Explanation: lymphedema is swelling caused by a blockage in the lymphatic vessels, which can be due to surgery, radiation therapy, or an inherited condition. Options A, B, and C, bacterial, viral, and parasitic infections, are not common causes of lymphedema. 9. Which of the following is a common symptom of acute pancreatitis? A. Nausea and vomiting. B. Constipation. C. Abdominal distension. D. Rectal bleeding. Answer A. Nausea and vomiting. Explanation: acute pancreatitis is inflammation of the pancreas that can cause nausea and vomiting, along with severe abdominal pain, fever, and rapid heartbeat. Option B. Constipation is not a typical symptom of acute pancreatitis. Option C. Abdominal distension can occur in severe cases of acute pancreatitis, but it is not a common symptom. Option D. Rectal bleeding is not associated with acute pancreatitis. 10. What is the most common symptom of heart failure? A. Chest pain. B. Shortness of breath. C. Palpitations. D. High blood pressure. Answer B. Shortness of breath. Explanation: heart failure is a condition in which the heart is unable to pump blood effectively, leading to a buildup of fluid in the lungs and other parts of the body. Shortness of breath is a common symptom of heart failure, along with other symptoms such as fatigue, swelling in the legs and ankles, and rapid or irregular heartbeat. Option A. Chest pain can be a symptom of heart failure, but it can also be a symptom of other conditions, such as angina. Option C. Palpitations can occur in some cases of heart failure, but they are not the most common symptom. Option D. High blood pressure is a risk factor for heart failure, but it is not a typical symptom of the condition. Now that we have taken the practice exam, let's talk about tips to prepare for your nursing exam. Preparing for a nursing exam can be stressful, but with the right approach, you can boost your confidence and improve your chances of success. Here are some tips to help you prepare for your nursing exam. 1. Know the format. Make sure you are familiar with the format of the exam, the number of questions, and the time limit. This will help you manage your time effectively. 2. Review key concepts. Focus on reviewing the key concepts and topics that are likely to be covered on the exam. Utilize study materials such as textbooks, lecture notes, and online resources. 3. Practice with practice exams. Take practice exams to help you familiarize yourself with the type of questions that may be asked. This will help you develop a strategy for approaching multiple-choice questions and improve your confidence. 4. Pay attention to details. Read each question carefully and pay attention to the details. Look for clues within the question and use context to help you choose the correct answer. 5. Eliminate wrong answers. Use the process of elimination to eliminate answers that are clearly incorrect. This will increase your chances of selecting the correct answer. 6. Be aware of common mistakes. Be aware of common mistakes that students make on multiple-choice exams, such as misreading questions or rushing through the exam. Stay calm and focused throughout the exam. 7. Don't second-guess yourself. Once you have selected an answer, stick with it. Avoid second-guessing yourself, as this can lead to changing your answer from correct to incorrect. 8. Manage your time. Manage your time effectively by allocating enough time to read and answer each question. Don't spend too much time on any one question, but also don't rush through the exam. 9. Get enough rest. Make sure you get enough rest the night before the exam. Being well-rested will help you stay focused and alert during the exam. 10. Stay confident. Believe in yourself and your abilities. Stay confident throughout the exam, and remember that you have prepared well.